Okay, the next taping that we're going to do is going to be for Achilles tendon taping. This is to help prevent an individual who has pain when they dorsiflect. So this will help prevent them from dorsiflexion. First thing that you want to do is you want to make sure that you shave or have the athlete shave their any hair that's over the area. Next, we want to make sure that we have our 2 heel and lace plaids. One is going to go over the Achilles tendon and just above that, just above the heel. Next, we want to apply our tough skin. Again, down to the mid-foot as well. And then we want to apply our pre-wrap. And again, our tape is basically going to go from the base of the calf, okay, to about the mid-foot to be most effective. Okay. And also, if you hadn't noticed, I also wanted to mention that in this taping, you do want to put the patient in a prone position rather than having them sit or in a supine position. Again, you put your pre-wrap down about to the mid-foot. Once that's on there, you want to put your anchors on there. And again, you're going to put your 2 top anchors up right at the base of the calf. Again, ideally this would go directly to the skin. But again, just to say the patient, I'm going a little bit lower. And also notice that I'm angling down the tape down a little bit because if you can't put this tape straight because it'll wrinkle. And you want to overlap your tape. Again, you can put 2 or 3, at least a minimum of 2. Like I said, if you want to put 3 on there, you can to make a good anchor. And then the other one needs to go around the foot. And again, you want to put 2 pieces down here. And again, you have to remember that the foot is going to spread when they stand on it. So when you go around this one, make sure that you can either spread the foot and close the tape, or just overlapping at 50%. Just kind of lay it down when you attach the tape. So you have 2 anchors and 2 to 3 anchors on the top and bottom. Once you have your anchors on, the next thing that we're going to do, and you can either use a 2-inch or 3-inch elastic con or some type of a heavy weight tape. You're also going to need scissors to cut this. And there's a couple techniques. The first technique, basically what you're going to do is you want to also make sure that they're in slight plantar flexion when you measure this. But you basically want to go from the one end of the anchor to the other end of the anchor over the heel. So again, I would measure this in that position. And then once I have that, you can cut the tape. And again, I found it a lot easier if you cut all of your pieces of tape first and then apply them, rather than measuring it each time. But either technique is fine. Again, you're going to put about 2 or 3 pieces on here, so I'll cut 3 because this is a 2-inch. Make sure that you don't cut your fingers with the scissors. Again, remember that they do need to be in slight plantar flexion when you apply this. So again, with this one, the first one is basically going to go straight up the the heel and attach to the anchor, top anchor. And the second ones are can kind of overlap. You can start on the medial side, and you notice that it just kind of goes over to the lateral side of the foot. Again, attaching to the top anchor. Again, remember, make sure that you keep them in slight plantar flexion. And then the third piece can start on the lateral side of the midfoot, crossing the heel in the center, and then going up to the top anchor. So we have three pieces. These are all pulling in a superior direction. Once those are on there, we can close this off. You can either close this off. Some people like to close it off with the elasticon. Some people like to close it off with white tape. It doesn't matter. But again, you still want to make sure that you're angling your tape. And again, make sure that the tape goes to the skin. And you also want to close off your bottom. Again, at least put 2 on there, again, flattening the foot. Or going loosely. And the last thing that you may want to do is to use some elastic tape to circle the whole thing, again, to make it again, overlapping about 50%. Maybe if we needed to attach that. And that is it for our Achilles tendon. Again, we would always want to check the sensation and the pulse. And last thing, we always want to check the function of this. So again, I would ask him to dorsiflex his foot to see if that is functional. And that is it for the Achilles tendon tape.